Good morning. I have a problem that I want to involve the Council of Elders in trying to find a solution. It has to do with the shortage of GPs attending to aged care residences. Dr. Patrick is going to be interviewed and he will explain his vision of what needs to be done, and I want to implore the Council of Elders to help everybody in the aged care industry by taking up the cudgel with the Minister and or the Assistant Minister in order to try and find a solution that will avoid a very serious problem down the track.
Since 1997, the Commonwealth Government has undertaken a series of support programs designed to assist in helping people live at home longer rather than move into residential aged care facilities. This strategy has been a success, but it has had an unexpected consequence. Increasing numbers of elderly are moving from home to residential aged care only when they have serious health conditions, and by its definition, residential aged care isn't equipped to deal with the level of medical support increasingly needed.
I think in the last few years, the people are coming to aged care with much more care that's required and medical treatment that's required. And I guess being in an aged care facility, yes, it is their home, but we still have to care for them. We have to care for them in lots of different ways, and medical treatment's one of the ways we need to care for these residents.
The services for home provisions are abundant and good, so you end up coming at a later stage. But because of that, you're no longer able, and you require a higher level of carers, experienced nurses and experienced doctors, because all the medical conditions that you come in with are end stage.
How serious is the situation when they get here?
It is life-threatening, simple as that.
I think the problem is there's not enough GPs that are willing and able to come to aged care facilities. And I think what residents like is to build the rapport, the relationship with the aged care doctor that they have, rather than getting an after-hours doctor or the geriatric flying squad, who do a marvellous job and of course can assist where needed. The other alternative is to send residents to hospital if we can't get the GP or anyone in to see them, but that's not good for our residents either. They don't know the doctor doesn't know them, and there's no relationship.
I feel very sorry for registered nurses in my own home in which I live. I have noticed on occasions that they tend to, at this stage, be more clerks than registered nurses.
Because I'm totally immersed in the situation, I feel the nurses' grief and stress. It's immense. The workload, the paperwork. On the weekend, I was at a nursing home. I spoke to the nurse. Out of his 8-hour shift, he does 6 hours of paperwork, 2 hours with the patient.
Well, we're a team trying to care for residents. We want our residents to live life to the full. We want them to have purpose and meaning, but we also need them when they're sick to be medically treated. And if they can't be medically treated, it puts a lot of onus on a registered nurse who wants to care for them but needs that backup.
We have the flying squad, yet the flight squad can only do so much, and they are not general. They're not the centre of patient care management. In other words, they're not GPs. So yes, they do come out and they do spare the resident going to hospital, and yes, they're trying to expand the load, the available services from the flying squad by recruiting more registrars. But yesterday I spoke to someone, and they're exhausted.
Recently, I was invited to attend another aged care home in Sydney as a representative of the Council of Elders. And the moment I walked in there, one of the residents of that home approached me with what he thought was a fairly important problem, in as much as he had a complaint to make about the lack of GP services in that home. On one occasion, I'm led to believe he was waiting for 7 days before he was able to get a GP to come and treat him for a problem that he had.
Yeah, we need a new model. New model's got to be tailored for the aged care facilities, which are in between general practice, communal care, and hospital emergency/intensive care. So the doctors that need to be enticed have to be experienced. It's very hard to have a rookie doing this job. And you have to have a system that rewards the doctors as a whole, that's simplified, that's not too bureaucratic. So not, for example, time-based, more maybe patient-based, Have you seen the patient? Yes, then you get rewarded for seeing the patient. You have to see the patient. You can't sit from afar and treat. You have to come and see, because the nurse will think one thing and then you look and you find something else. Maybe the college can be involved in training, just like rural GPs, aged care facility GPs. So you've got general practitioners in the community, you've got rural GPs, which are more skilled, and you should have geriatric GPs as part of college training options. We've got to ramp that up quickly because we really need them. Get GPs more involved en masse, otherwise we're going to have lots of gaps, and it won't be measured, because if someone passes on, they're frail, they're old, they died. So it just gets swept.